Have you ever had pain in the front of your foot right there? Well, that's what this big word right here means, metatarsalgia. Foot pain due to unexplained reasons in the front of the foot. But there's always an explained reason, and there's very common reasons. I'm going to tell you how to find out what's wrong with yours and a plan to take care of each of these. And if it's not a direct cure, it will at least reduce the symptoms and tell you where to go for more information. One of the most common causes of metatarsalgia is a short, big first ray, that is a short toe. This takes the pressure off the big toe, so you're pushing off less, and puts all the pressure on the second and third metatarsal heads. This is the classic definition, essentially, of metatarsalgia: generalized pain in the midfoot. But you see, it's just poor foot structure that can be corrected. And once you get the pain down, there are ways to correct it. And I will get into those in a second. So what happens is, you don't have an even parabola on your metatarsal heads, so this is your weight-bearing area. And this can cause bunions to form. In fact, bunions are a cause of metatarsalgia because the big toe is more loose and it puts all the pain right here. And then since you're putting all this pain on the front of their foot or this pressure, you could also develop a neuroma that's a thickening of the nerves that run in between your metatarsal heads. These are these bones right here. So as they're squeezing together, they can compress one of these nerves and cause damage. And then the nerve swells and starts throbbing and causing pain. And you get a clicking sensation in your toes. Another common thing is metatarsalgia as you're running on it, standing on your feet all day. This could cause a stress fracture. So what a stress fracture is, it's not a complete break like as in a fall, but what happens is over days or weeks of chronic stress and pressure, the bone cracks, gets irritated, forms some extra bone trying to heal itself. So right here is the stress fracture early, but then the stress fracture eventually later as it heals up. So the causes of metatarsalgia, or the things that lead to Morton's neuroma, capsulitis, all these things that I just mentioned, are a short first metatarsal or a loose first metatarsal like in a bunion, a long second, potential arthritis, tight calf muscles. This is the key to everything and what treatment will focus on. And a hypermobile first ray is similar to the causes of a bunion. So here's what you got to understand when you're looking to treat your metatarsalgia pain. As you walk, you're supposed to have a certain distribution of heel strike to midfoot stance, which is your entire foot planted on the ground, to push up on the foot. But what happens is people with tight calves, as they walk, have a very large percentage of their stance phase on the toe off. So instead of your heel and your midfoot bearing weight, all your weight's on the front of your foot. And not just that, if your big toe is not even contacting the ground, or a less percentage than it should be, all that pain's on your second and third digits. So what you have to do, first step, is decrease the pain. Take some anti-inflammatories or even topical anti-inflammatory creams, and check with your doctor on these because you may have heart problems, kidney problems, that kind of stuff, or stomach problems. But do that for about a week or two to get the pain levels down so your body has a chance to heal. Ice, especially after a long day, freeze a frozen water bottle, roll it under your feet for 15 to 20 minutes. You could put a shirt or some cloth in between there if it's too cold at first, but this will numb it and this will increase the healing by scaring off the inflammatory cells, and after you take away the ice, flushing them away by reopening the blood vessels. Then massage the front of your foot. Tennis balls, golf balls work well. This is great for the arch of your foot if this hurts as well. And you can look into getting over-the-counter metatarsal pads at corner stores, convenience stores, that kind of thing. If that's still not working, because that will only take care of the pain, but it won't keep it away long term, look into great shoes. In Detroit Foot Pain Clinics, we have great guides on our website how to get these things, over-the-counter inserts. These aren't very expensive, $20 to $30, but you got to make sure to get the right ones. There's a lot of cheap imitators out there. Stretch out your calf. I should have mentioned this actually in this treatment, but studies show using calf stretches foot stretches, hamstring stretches, that is the key. As I mentioned earlier in this slide, you don't want to be one of those people that spend 50% of their time in toe off rather than the normal 30% or so that it should be. So stretch that stuff out. And again, DetroitFootPain.com, lots of stretching videos, so check that out. And then eventually see your podiatrist. If you're still not healed, then you may need a night splint. You can buy those over the counter, but what that does, that stretches the muscles and ligaments on your foot long term throughout the night. You may need physical therapy. You might have some contractures, some bone spurs, that kind of thing. Custom orthotics. If the generic over the counters aren't working for you, and for some people they don't, it might be a good idea to get custom molded ones. And then the main thing is, but of course you already knew this and it's a problem for everybody, weight loss. But the more weight you lose, the less pressure on the front of your foot. Do not try any of this at home alone without supervision. This is presented by Michigan Foot Doctors. If you think our information helped you, give us a thumbs up and come visit the site for even more.